The hip is something that's interesting to assess when you're looking at treating the lumbar spine post-motor vehicle accident, because there's a lot of restrictions that can come from the hip. I think it's because of the force going through the femur and causing the femoral head to hit the acetabulum. There's the standard test that you can do where you have the patient go into a Faber position just to see if they're restricted on one side compared to the other. There's the flexion, internal and external rotation tests you can do. And you're looking for about 45 degrees on each side. Those are good tests to find out general mobility. I'm really interested in the rotation of the hip into extension. So what I do is I usually have the patient lie on their side, so in this case on the left side, when I'm going to assess the right hip. So go ahead and lie on the left side. And I'm going to assess hip extension. And then I'm going to assess hip rotation. Sometimes you'll see in a motor vehicle accident, I'm just going to get a pillow, that the hip extension in internal rotation quadrant is stuck. So instead of having it like this much, you'll feel that it's restricted this way. You always have to compare it to the other side. The way I compare it to the other side is I'll have the patient lie on their stomach, and I'll have them put their knees together and bring their legs apart. And I'll look to see, and there'll be one side that is more restricted than the other. So it'll typically be a side that's more restricted where it should be moving this far, and it only moves this far. It's a lot more common than you think, and it might be the femoral head just being restricted within the acetabulum. The treatment of this, you'll have the patient, if it is the right hip, lie on their left side. And what we're looking at is feeling up the greater trochanter and trying to see if we get this rotation. There are therapists named Gail Malloy and Fred Stute who showed me this technique, which you can get the hip at the barrier into extension and internal rotation and take your thumb and put it right on the greater trochanter. Then you would hit your thumb to try to spin the femur into internal rotation, like this. In doing so, you typically will pick up greater internal rotation of the hip and extension, so you want to follow this up with a functional exercise. So you have the patient, don't let me pull you forward, and you have them bring into extension and internal rotation. And hold, 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 and relax. And again, don't let me pull you forward. And relax. Then you want to get them to do some standing exercises to work that internal rotation. Again, staying consistent with the theme that we're working towards functional progression of our exercises for everyday use.